This is part 2 of the cranial bones, where we will first start with the cranial cavity, and then we will look at the inferior view. So first we have the frontal bone here. This would be the ethmoid bone, where you could see the crista galli is kind of poking up right here. This is the sphenoid bone, the butterfly-shaped keystone. These are the optic canals. Now, in terms of the foramen, I always start with the foramen ovale because it's one of the easier ones to find. It's this oval-shaped one, part of the sphenoid bone. And I remember the acronym ROS for foramen rotundum, foramen ovale, and foramen spinosum. From there we have the temporal bone, to which we can find the internal acoustic meatus. From there we have the jugular foramen, which is this big one right here. And then we have the foramen magnum, as well as the hypoglossal canals on either side. On the inferior view, we'll start with that foramen ovale again, so we can find those right there, those oval-shaped openings. So foramen ovale, we cannot find foramen rotundum from this view, so we have ovale, spinosum. From there we have carotid canal, which you can't really poke through on this skull model. From there we have the jugular foramen, the hypoglossal canal, and then the foramen magnum. Can't forget we have the mastoid process and the styloid process, and in between those two we have the stylomastoid foramen. Other landmarks, this would be the occipital condyle. This is the mandibular fossa, which articulates with the condylar process of the mandible. And that should be it for the major cranial landmarks on the inferior view of the skull. We are next going to look at the ethmoid bone and the sphenoid bone independently. So let's start first with the ethmoid bone. So this shark fin right here is the crista galli. This is the cribriform plate, and all of the little openings are the olfactory foramina for your sense of smell. This is the perpendicular plate, and then these are the middle nasal concha. Now we have the sphenoid bone. We have the lesser wings. The greater wings are the bigger ones. If you remember the acronym ROS, we have foramen rotundum, foramen ovale, and then foramen spinosum. We have the sella turcica, which stands for Turkish saddle, like the saddle of a horse. We have the optic canals, and that's all you need to know for the sphenoid bone.